discussing something very important, something that I know that you might at some point or the other have experienced. I'm simply saying curbing errors and misdiagnosis in our health care system. Okay, that's a topic for tonight. I mean, medical errors and misdiagnosis. In fact, it's a big challenge. It's actually a big challenge in our healthcare system, and tackling it, yeah, would require the support of the government, no doubt. It definitely will, of course, require the support of the government. And misdiagnosis, if you don't understand, well, it occurs when a diagnosis is when a diagnosis is missed, inappropriately delayed, or even wrong. I mean, there are cases where, I'm sure you've heard cases where people go to the hospital and they're being treated for the most common one, typhoid and malaria. You know, it's happened to a couple of people around me, they go to the hospital and it's basically typhoid and malaria. But at the end of the day, they get a second and a third opinion, and they find out that, in fact, despite the treatment for typhoid and malaria, it is still not getting better. And the hospital runs tests and all, not like they don't. Now, I'm not even talking about those who go self-medicate, okay? And at the end of the day, after the tests and all, the hospital treating you for typhoid and malaria, and at the end of the day, you find out from, second and third checks from some other place, you find out that that's not even what it is that you're meant to be treating for. I'm sure you've heard these stories. So the consequences of misdiagnosis, they're actually numerous. They're costly and, of course, reduces trust in the healthcare system. Okay, I've had my own fair share of this, and even talking about errors, I've had my own experiences too with the errors. I'm talking about a situation where I had to pull out a tooth. I had a bad tooth. I went to the dentist to pull out a tooth. First of all, the person who did the extraction was very coarse, he was acting like we had a problem earlier on. And this is someone I don't know. He was so brash, unprofessional. And guess what? He pulled out a good tooth, leaving the bad tooth. And it cost me so much pain, sleepless nights. And at the end of the day, I ended up having to undergo a dental surgery because of that singular act. So that's what we're talking about today, okay? I mean, when health condition is diagnosed wrongly, or these errors occur, the patient will be treated wrongly, and this could lead to serious complications, even death. So the question tonight, my darling, on Electable Ideas, should there be a government agency or unit, okay, that logs in errors and complaints in our health sector? Like the way Savicom used to be, the way Savicom is, for service delivery. Should there be something like that? Or what do you think should be done? Call me up, let's talk. Of course, we're live on YouTube and Facebook. Nigeria Info Abuja on YouTube and Facebook. Okay, so please join in on the show live. They were streaming live. Joining on the show, Nigeria Info Abuja on YouTube and Facebook. Give me your take. What do you think? Should there be an agency or a unit, okay, that logs in these errors and complaints in our health sector? Or what else comes to mind? What do you think can be done? Let's talk. Hello?
Hi.
Good evening.
Good evening. How are you?
I'm fine, thank you. What's your name and location?
My name is Otisi.
All right, Otisi, great to hear from you. Where are you calling from?
I'm calling from Guarimpa.
Great, let's talk.
I want to ask you a question before I continue. Is there anything at all that you know that is good in Nigeria?
Yes.
Anything?
Yes, there's a lot good in Nigeria. Look, we should stop. No, if we keep... Look,
Nigeria is a blessed country. God bless Nigeria.
Good.
We don't have leader. Our country is just, I don't know how to describe it. Yesterday, I ate yesterday. I couldn't drink water. There is nobody that can accept transfer of 20 naira. Or there is nobody that can accept transfer of 100 naira or 200 naira to go and buy water outside. I could not be able to drink water. There is nowhere, no shop I have not gone to just to buy water. Nobody accept transfer. I ate, I could not drink water. I can't have money, no cash. Anywhere I drink up to 2 miles.
Wow.
looking for 500 naira or 1,000 naira could not get it. What do you think is good in our country? Nothing. Look at what Nigerians are passing through.
I get you, my brother. Sorry about the situation, your experience. But let's not deviate from the topic at hand. And the question is, how do you think these errors
I
and...
understand what you are saying, but I'm just saying that you are talking about the health sector.
Yes.
But presently now, we look at the country, I don't know. I don't ever before now that I don't know how to just life.
All right. Thank you so much for calling in. 0809 597 4869. 0809 597 4869. And of course, we have 0700 951 0000. You can call the studio lines. Let's talk. Hello.
Hello, good evening.
Good evening. What's your name and location?
There's Muhammad from somewhere in Abuja.
I didn't get your name, please.
Muhammad from somewhere in Abuja.
All right, Mohammed. Great to hear from you. Let's talk.
This is a very good and important topic to treat today. Because I had a similar issue some years back. I went to donate the blood to someone at the hospital.
Okay.
Unfortunately, I had a test. You do some tests before receiving. So after the test, the result comes out. They said I have hepatitis B.
Whoa.
Hepatitis C, and I know nothing about hepatitis. And the program to donate the blood for, I think it should be 4 years. So the next thing I was shocked was regularly on the norm. I have cousins when their wife wanted to get, do the normally do now, you go, you donate blood.
Sorry, I can't hear you. You're quite inaudible.
Can you hear me now?
Yes, I can. Let's talk.
If anybody wants to do that, really do it now. You have to pay for blood. So on the norms, I'll donate for my cousins, family members. Because I do fitness, I do exercise, I don't take my body. I was a bit surprised now. The lady came to me, I was crying that she needs assistance, the blood for her son, he has hepatitis C. I said, that's just if she said yes. I said, let's go. To the hospital, they tested me, they said I have hepatitis C. I was shocked, confused. I left the hospital. I was a bit traumatized for like a week, 2 to 3 weeks. So I was thinking about that.
Oh, okay.
I educated about hepatitis A, B, and C, and how to contact them, how to stay from stuff like that. And I found out that all those things I'm reading, I didn't do any of them. So how come when we have hepatitis C? The next thing I have to go and do some tests from different places.
Okay.
I got the result. And what I got was this.
What you got was what? Oh, the network isn't clear. I can't hear you anymore.
Hello?
Yes, you said what you got was what?
From the other clinics around, I did test. The result was different. I didn't have it.
Thank God for you.
Very upset.
So now, after that experience, what do you think can be done? I mean, being...
That's what on this.
Yes, please, go on.
And I know there are a lot of people that can agree.
Yeah, sure.
You go to help someone, the next thing they tell you have something in which you don't have it.
Mm.
They tell you have HIV, you don't have it. You get?
I got you.
And this one is your own people. But this thing is very serious for people.
Mm.
Let's say for
All right. That was taking too long. Okay, let's talk. Call me up and let's talk. Tonight on Electable Ideas, the topic of discussion is, or rather the question is, should there be a government agency or unit, that logs in errors and complaints, in our health sector? Have you had such experiences? Let's talk about it. Hello.
Hello, good evening, Blaq.
Good evening. How are you?
I'm fine, thank you.
Great to hear from you. What's your name and location?
This is Rejoice,
All right, Rejoice.
calling you from Guarimpa.
Great.
Yes.
Let's talk.
So, about the topic on ground.
Yes.
You see, it's not everything that we're supposed to wait on the government, this and that. Being that there are different complaint units, if I will call them that.
Okay.
Where you can go to report all those Savicom and others. I don't know their names.
Mm-hmm.
So, but at this point, when you get this health issue,
Yes.
I think it has to be from the personality thing.
How do you
All the
mean?
people working there.
Okay.
Like the people, yes, the health workers.
All right.
I think they should be more. They should be kind. They should take humanity first.
Mm.
And they should have sympathy for human life, because you see some people working there, they don't have. It's as if they are being forced to do the work. You understand?
I get you. I totally get
So
you.
there's this, yeah. So I think they should be, and people should do what they like to do what they really enjoy doing, and that's another way of improving such.
Okay. So you're saying if they're not, if they don't enjoy the job, if the kitchen is that hot, it's so hot they get out of the kitchen. Is that what you're saying?
Exactly.
All right, my dear. Thank you so much for your take and keep enjoying the show. Okay? Thank you. It's Electable Ideas on 95.1 Nigeria, info your number one talk station. And the phone lines are open. I'm waiting. I need your take on the matter. How do you think this situation can be curbed? I'm talking the errors in the health sector. And I just told you about my experience. And even someone close to me, was on admission in the hospital not too long ago and was really sick, really, really sick. Of course, as a result of wrong diagnosis, the usual malaria and typhoid, not knowing that the person was dealing with another level of pneumonia. And got to the hospital, and even the staff who was administering antibiotics, into the drip and all, brought something totally different that would have even cost this person's death. If not that, the person that was sitting next to me was a pharmacist who just asked to see what it was that was going to be injected in the drip. So these things happen every other day. How can they be curbed? What can be done? Let's talk about this. Hello?
Yeah, Black Coffee, good evening. How are you?
Good evening.
Black Honey on the line.
All right, Black Honey, let's talk.
Electable Ideas, Black.
Yes, please.
What I believe, we have a system in place already, but they are not so visible. Like the professional bodies, the Medical and Dental Council of Nigeria, if you reach them and you have a complaint, they always have committees that look into such situation. But it's just that they are not visible enough. And what I would recommend is they should make themselves more visible, maybe create online platforms. And for those who don't have that capacity to use, who are not IT savvy, the old school method of having suggestion box at critical points within the health facility would suffice. So if you have such complex group BP, that make sure it's followed up. The issue is that they should make themselves available and then implement now do a kind of solidarity and team up against the patient and then put him down. And that's just the little suggestion I have, really.
Okay, thank you so much, Blaq Honey. It's a pleasure getting to hear from you. Okay, what is your take? What do you advise? How do you think this can be curbed? I'm talking the misdiagnosis. I'm talking the errors. I've given a couple of examples. Okay, how can this be curbed? Could this be as a result of, the state of mind of the staff, in the hospitals or the clinics? Maybe they're not in the right frame of mind. Like Blaq Honey suggested, that there should be a lot more awareness and possibly online platforms where people can actually, lay their complaints. What is your take? How can this be curbed? Hello?
Hello?
Good evening.
Yeah, this is Mohammed from somewhere in Abuja.
All right, Mohammed, let's talk.
So what I was saying earlier about,
Yes, please.
after the test, I got the result. And quite different though. So although I won't mention the hospital, because I just forgive them and let bygones be bygones. This thing, after everything, before, although if I want to handle anything, I want to treat something, I look it from both angles. So I came to my own conclusion that I'm going to sue the hospital. My elder brother is a medical doctor. He works there. I have some people I know they work there.
Okay.
I have a lot of health workers around in my family, so which they know that if I want to do something, I'll do it. So before you know, they sat down, they talking, this one talking, they just made me understand one or two things. So that was why. If not, there is no way. I doubted that even though you try to do something, you complain, you shout, you're wasting your energy. The only thing I don't trust me. The only advice I can give to anyone now, once you do any test anywhere, you have to do another one. You understand?
So you're saying...
Because instead of wasting your energy trying to complain or do this thing.
No, but if we keep saying that, instead of wasting energy laying complaints, but they see, I think that these things we can't keep pushing these things on the carpet. I remember, just like you experienced, my younger brother who went run a test. No, please don't. I don't want you mentioning any hospital, but I'm just simply saying.
If I sue them, it's very serious. It's no idea. I don't want to mention anything here. But the reason you're saying like this is very serious. Because it has put it very serious. But when I'm doing something, I put a lot of energy into it.
All right. Thank you for your thoughts. Thank you for your thoughts. And really sorry about the experience, my dear. Okay? Thank you for your contribution. So someone sending Tunde Balogun on WhatsApp says, good evening. There's a council in charge, the Medical and Dental Council. Okay, thank you for that one. But the thing is, should they create a lot more awareness, like Blaq Honey has said? Because I can tell you that some people, quite a number of people are not aware of this. Okay, so what do you think? I mean, one, of course, should be more visibility, intense publicity, visibility. That will help, all right? But outside that, how else can this be curbed? Okay, are we going to keep pushing this under the rug and saying we're leaving it to God? Is that the way? We're going to let things slide? Just like the young man who just got off the phone. I remember someone who went to run a test and, the result came out. This is my younger brother, the result came out. This was some years back. And the test result came out and it read that he was 4 months pregnant. I mean, this is a man we're talking about. So all these mistakes, could it be that the mindset, should something also be done? Okay, some kind of reorientation for health workers or particular health workers who handle particular cases. and all, because yes, there's a lot going on here and there. A lot of people are not stable, if you know what I mean. So what do you think? Do you think that they should be paid more attention? How can this be curbed? Okay, let's go straight to Facebook. I see Facebook, Eric Moja. Eric Moja says, you're doing well, right on. Thank you so much. And George Andrew, I can't pronounce the other name, says, love this program. Thank you so much, Paul Candy. Lokosu, I'm with you listening. All right, thank you so much. Good evening, nice topic, Black Coffee. Thank you very, very much. Please feel free to joining on Facebook and YouTube, Nigeria Info Abuja. That's what it is, Nigeria Info Abuja. How can this be curbed? Hello?
Hello, my darling.
Yes, good evening. How are you doing?
I'm fine. How is everything?
Fine, thank you very much.
How today? How is your day?
My day's been good.
I know that all days are good for you.
Yeah, well, thank God. So how do you, I don't know if you're listening to the topic at hand, the topic of discussion on electable ideas tonight. I don't know if you're...
Join you. No.
All right, so just pay attention, okay? The show is about, this segment of the program is about to end. But please just pay attention, and I'm sure you might have one or two things to say before the show comes to an end, okay? Thank you. All righty. Okay, 0700 951 0000 and 0809 597 4869. Well, yes, I think so far from what a few callers have said, majorly visibility is important, okay? Someone has told us about the medical, the medical and dental council, okay, the reports can be made, and now you're aware, please, okay, you can always, go there and find a way to reach out and lay your complaints of these errors and all. And also, I also think that this organization should find a way to get across to more Nigerians, to get, create a level of awareness. All right. And I don't know. I was expecting someone to say, they suggest some kind of, what's the word to use now? I don't want to sound brash, but I mean, there's a lot happening. A lot of people are not outside work. Of course, we all have our private lives. This and that is happening. So I think that the health sector needs to pay more attention to their staff and find a way to help people balance what is going on the outside and work, and then help people stay a lot more professional. Okay, and like someone called in and talked about the fact that I also mentioned the fact that I got very shabby service. Okay, the person who extracted my tooth acted like we had a fight before I came in to get the tooth extracted. We need to be a lot more professional no matter what, okay? Because at the end of the day, this is a health we're talking about. And this entails human life and humans' well-being. We should be a lot more careful. I'm referring to people in the health sector. We've come to the end of the show, Electable Ideas. Catch you next week, Friday, 10:30, same time, same station. Keep it locked.
Back to back and back.